Hello, everyone, and welcome to the University of Southern Indiana. We're excited to begin this journey with you. My name is Michelle Wakefield. I am the director of the graduate nursing program and the graduate clinical liaison. Today, I wanted to spend a little bit of time to hopefully answer some of your questions regarding clinical hours and clinical opportunities. You will get some in-depth specific information regarding your desired or your declared specialty, but this is an overall view for everyone's clinical rotations. So direct clinical encounters begin in the fall with the specialty courses. Graduate nursing students complete required clinical learning hours with qualified clinical preceptors. So preceptors may not be relatives or in any relationship with the students. Preceptors also need at least 1 year of experience as an advanced provider. Graduate nursing clinical practice requirements may be completed in the student's own community. All agency, preceptor, and site surveys should be finalized approximately 1 month prior to beginning clinical rotations. Students must be licensed in the state where they are performing clinicals as well. The student is responsible for identifying preceptors and clinical sites in their own community, with the exception of states that require university responsibility for securing preceptors. Approval of selected preceptors and clinical sites must be obtained through the graduate clinical liaison prior to beginning any clinical hours. Now, we know some students may encounter difficulty obtaining a clinical placement for completing their advanced practice clinical hours, and we ask that you please communicate this difficulty with the graduate clinical liaison and the director of the graduate nursing students. And that would be myself at this point. And I will provide you my email at the end of this presentation. When you reach out to me stating difficulty obtaining clinical placement, I ask that you clarify that you've had no opportunity to work with a preceptor at your current place of employment. You send us a list of organizations that you have contacted just so that I don't duplicate your efforts. I also ask for you to provide me a geographical location and if you obtain a compact license. We also want you to continue to communicate with us. Should you find placement while we're working together, please let us know. Please let us know of your success, and that we can mark your completion or your finalization of your procurement of clinical placement. And then graduate faculty and staff will collaborate with the students to secure a clinical placement, but it may require travel to access these opportunities. Please be aware that there might be need to utilize a third-party clinical placement organization, which may incorporate organizational fees associated with securing those placements. These could include fees for placement services or administrative expenses from these external agencies. Now, these fees are third-party placement or even travel are the sole responsibility of the student. Professionalism is always of the utmost importance, and so we need to make sure we arrive promptly to begin our clinical day. We need to make sure we notify the site and your clinical advisor, your clinical instructor, if any changes have to be made to your calendar. We strongly suggest keeping your phone on Do Not Disturb or silent. That way there's no personal interruptions from family that are text or calling you, with the exception of emergencies. Again, professional attire, dress, demeanor, and interactions are expected at all times. And this is not just interactions with your preceptor. This is interactions with all the office staff, all the hospital clinical staff that you encounter. Professionalism is the utmost importance. We need to make sure that our documentation is accurate, but it's also timely. And just remember that every interaction is a potential job interview or someone that you may ask for a professional reference. When you are admitted to the graduate nursing program, you will be assigned a clinical faculty instructor along with your advisor. These may be the same person, they may not. So the difference is your advisor is your academic advisor that will help you with all of your course questions. The Your clinical faculty instructor will be specifically for those specialty course rotations. And again, those start in the fall for every specialty. We try our best to keep this person the same so that they can better assess your progress through the program. This doesn't always happen, but that is our goal, is to keep you with the same clinical faculty instructor throughout your specialty course rotations. Things you will have to provide to your clinical faculty instructor would be a copy of your clinical practice calendar. This is completed through our third-party platform known as Typhon, and we're going to talk about that here in a minute. But you'll update your schedule within Typhon, but then you also need to make sure you notify your advisor of any changes, as well as your preceptor if there's any changes needed to your calendar. You cannot complete any clinical hours unless that clinical instructor has your schedule and has approved your schedule before you start that clinical rotation. With all clinicals, our dress code is professional, so you want to wear your white lab coat or vest, closed-toed shoes, and no blue jeans. Typically, we tell students to follow the guidance of their preceptor and facility. So many facilities have different requirements that it's not feasible for us to list all those. If you are in a rotation where there is a high likelihood of exposure to blood and body fluids, then perhaps the better choice would be scrubs versus an outpatient setting. Maybe business casual or business attire is more fitting. And so again, you'll want to check with your facility to see what their requirements are. But regardless, our students, from our standards, no blue jeans, and you need to make sure you have your toes covered just for safety and protection. We always encourage our students to use clinical guidelines to help as a resource for them, and have that resource on you. Nowadays, it can be a phone or a tablet with online resources such as Epocrates, UpToDate, or Stat Pearls. These are all instruments that will help you make good, sound clinical decision making. Again, we can't reiterate it enough. All your documents have to be up to date in Castle Branch before you can go to clinical, and so you can stay in clinical without delay. Formal clinical application process, including completed written affiliation agreements by agency. These are referred to as educational agreements. It can also be called a memorandum of understanding or an MOU. Some people also refer to it as a clinical affiliation. But this is required prior to initiating clinical experiences. You can send a copy of this initial request to the USI1 Nursing at usi.edu email, and you can also send an email to this address to inquire whether we currently have an agreement in place out of maybe a local facility or your workplace to start that process. Now, nurse practitioners and PA preceptors must be board certified in their specialty areas corresponding to the student's specialty track. All preceptors must, again, have that minimum of 1 year's practice experience as an advanced practice provider. No clinical hours are allowed during university holidays or when courses are not in session. And students may be required to visit campus to demonstrate clinical competency. Faculty will also validate clinical competency through multiple venues, including conference calls with preceptors and students. Video recordings may be used as a method to evaluate clinical competency. Clinical must begin by week 3 of the clinical course and continue weekly while registered for a clinical course. With faculty approval, clinical hours may be rescheduled during the clinical semester due to unforeseen circumstances, and rescheduled clinical must be approved by that clinical course faculty. Clinical schedules must be provided to clinical faculty prior to attending any clinical time. Now, when we talk about the paperwork involved with clinical rotations, I started talking about the initial request for the Memorandum of Understanding, also known as the Clinical Teaching Agreement or Clinical Affiliation, Education Agreement. Many facilities have different names for them, but it all means the same thing. That is one of the 3 pieces of paperwork that have to be turned in prior to your clinical rotation. This is a legal document that is created between the university and the facility that discusses things as far as who's responsible for what, who handles if something happens, kind of that. Again, it's a contract between the university and the facility. So the only component the student has of that is entering or submitting the piece of paper known as the initial request for that memorandum of understanding. That gets sent to the USI-1 Nursing at usi.edu email, and that process will then be started on behalf of the student. Two other documents you need are the preceptor agreement and the site survey for all rotations. So the preceptor agreement you need a preceptor agreement for any preceptor that you plan to do clinical time with. This allows us to vet that preceptor to understand or to verify that they are indeed in good standing with the medical society, that they are within the scope of practice that's needed for your chosen specialty. In addition, you need a site survey. The site survey talks more about the actual clinical site. What does that clinical site look like? How many patients do they see per day? Should we be concerned that maybe you're not going to get adequate training with, they don't maybe have the acuity that would sustain you through your coursework. So again, for every preceptor, you have to have a preceptor agreement, and you need a site survey for every location. So let's say you are in an office setting or a hospital setting, and there's two preceptors that agree to take you and help. They may rotate to get the time that you need completed. That may require just one site survey because it's the same site, but it's two different preceptors, and so you would need two separate preceptor agreements. In addition, perhaps from a family practice perspective, maybe you are following a family practice provider who not only sees patients in the office, but sees patients in the nursing home. You would have one preceptor agreement, but then you would require two site surveys because you are then following that preceptor to two different locations. So once your paperwork is submitted, you will receive a green light email that confirms your ability to begin clinical rotation. If you are going to utilize the same preceptor for multiple courses, that paperwork stays active for 1 year, but please be sure to include all course numbers on that preceptor agreement. Any clinical hours completed without the proper paperwork will result in a performance improvement plan, and those clinical hours will not count. In addition, students need to make sure they are up to date and have a complete Castle Branch account with all the required components completed prior to any clinical rotation and during your entire clinical rotation. At any point, if you become non-compliant, you will be pulled from clinical and you will not be able to return to clinical until that is up to compliance standards and it is verified through that third-party repository. The iHuman program is an essential tool for evaluating students' clinical decision-making and patient management skills. All students enrolled in the Adult Gerontology Acute Care Nurse Practitioner, the Adult Gerontology CNS, FNP, and Psych Mental Health programs are required to purchase access to the iHuman software. This purchase is mandatory for participation in the Nurse 618 Advanced Health Assessment, your Specialty 1 and Specialty 2 courses. iHuman will be used to simulate patient scenarios. Faculty will evaluate students' ability to assess and manage patients within their chosen specialties through these simulations. Students will receive detailed instruction on how to register and pay for the iHuman software on the first day of the Nurse 618 course and in Specialty 1 and Specialty 2 courses. It is the student's responsibility to complete the registration and ensure they have access to the software before course activities begin. Failure to purchase and register for iHuman by the specified deadline may result in the inability to participate in required course activities, which could affect course performance and grades. Technical support and troubleshooting guidance for iHuman should be completed through iHuman directly. These are considered indirect clinical hours for the program. Typhon's Nurse Practitioner Student Tracking System is an intuitive and secure student tracking platform that logs, tracks, and manages student clinical data. Information includes patient demographics, diagnosis, and procedure codes, along with skills, medications, and clinical notes, without exposing HIPAA-protected health information. Students can also enter shift time and time spent in other activities, such as using the time log feature. Typhon's NPST allows clinical coordinators, faculty, and preceptors to track students' progress and accuracy in real time as they learn in the clinical setting. For every clinical experience, the student will enter all patient encounters into Typhon. This provides ongoing documentation and tracking of the total amount of clinical hours and types of patient encounters and experiences. Students will be required to enter patient encounters following the clinical encounter. You, as a student, are responsible for ensuring your clinical preceptor approves your time. Students are also required to view the instructional videos, enter the preceptor information, and verify that the preceptor agreement and site survey are uploaded. Students may upload their clinical schedule within Typhon systems and must maintain an accurate and updated schedule. Clinical experience may not begin for the semester until after the first scheduled class, and the student is responsible for uploading their clinical schedule into Typhon before beginning clinical. Clinical hours done without faculty knowledge will not count towards clinical hours. Clinical experience may not be scheduled over university holidays, and clinical may be done during evenings, Saturdays, and Sundays if the course faculty approves. Paid working hours will not count toward clinical hours and would be considered falsification of clinical hours. All students enrolled in the FNP, Adult Gerontology, Acute Care Nurse Practitioner, and Psych Mental Health Nurse Practitioner programs are required to purchase the Barkley Board Review product during the second half of their Specialty 2 course. This purchase is mandatory to ensure adequate preparation for the board certification. The Barkley Review includes a series of multimedia modules featuring videos and other resources that comprehensively cover material necessary for board certification exam. These materials are intended to reinforce knowledge and provide strategic guidance for successful exam performance. Students will be provided with detailed instruction on how to register and pay for the Barkley Board Review during their Specialty 2 course. It is the student's responsibility to complete the registration process and gain access to the materials in a timely manner. Failure to purchase and access the Barkley Review by the specified deadline may hinder students' preparation for board exams, potentially impacting their success. It is crucial that all students comply with this requirement to ensure they are fully prepared. Students often ask, how much work is this going to be for me? Is it manageable? And so I just want to provide this quick breakdown of an example of how you can calculate your time moving forward. So if we look at a course, say Nurse 663, and this is a 3-hour course, a 3 credit hour course. So you need to plan on 3 hours of preparation for each class hour. So if it's a 3 credit hour course with 3 hours of preparation, then that's 9 hours just for your reading and completion of assignments. Now, if it's a clinical course, let's say you have to do 200 hours over 15 weeks. This again is just an example. I'm using easily multiplied numbers here for ease. So let's say you have to complete 13.3 hours at a minimum each clinical week. That will get you your 200 hours over 15 weeks, right? So you need to plan on a minimum of 3 hours weekly for your clinical preparation and documentation of the clinical experience. So if we take our 9 hours for our reading and assignments, plus our 13.3 hours of direct patient clinical time, plus our 3 hours to prepare for clinical and document our clinical experience, then we're looking at 25.3 hours at a minimum each week that you are investing in just this one course. So I don't tell you this to scare you, but I do tell you this for full transparency that it's going to be some work. It will be rewarding, but just so you can plan accordingly. Within our Typhon program, we do have an option to track procedures that students are a part of during their clinical experience, but any procedure completed during clinical time by the student must be done under the direct supervision of an assigned privileged clinical preceptor. So students are required to follow the institutional policies and their assigned state's scope of practice regarding procedures to be performed. Why we bring this up is because perhaps a preceptor does a procedure, but we have to make sure that that preceptor has privileges within the facility that they're completing these before you can then do that procedure under their guidance. When it comes to malpractice, students are covered in the student roll by the university, but the university's malpractice insurance does not cover the preceptor. So if you are acting as a student in your clinical rotation, our malpractice insurance will cover you. It just does not cover your preceptor. Next, we're going to discuss the critical evaluation criteria. Clinical evaluation includes satisfactory achievement in the delivery of patient care according to established clinical evaluation criteria. Critical elements of the clinical performance are indicated on the clinical evaluation form. Students must pass the clinical portion of a course in order to pass the course. To pass clinical, students must meet or exceed all critical evaluation criteria as indicated on the clinical evaluation form by the end of the semester. Failure to pass clinical will result in course failure. Clinical course faculty will complete formal clinical evaluations of students twice per semester, at midterm and at the end of the course. The clinical evaluations will consist of questions and criteria that are influenced by the AAC and Essentials for Advanced Level Nursing Education. These evaluations will assess students across various domains critical to advanced nursing practice. Students will be evaluated in each domain with one of the following ratings: does not meet, meets, or exceeds. Any student receiving a does not meet rating in any category at the midterm evaluation is required to schedule a one-on-one meeting with their clinical faculty. During this meeting, the student and faculty will discuss areas for improvement and develop a plan to address any deficiencies. To successfully pass the clinical course, students must achieve a minimum of meets on their final clinical evaluation in all domains. A does not meet rating on the final evaluation in any category will result in failure of the course, and the student will be required to meet with faculty to discuss further actions. All clinical evaluations, including midterm and final evaluations, will be documented in the school's third-party repository. This documentation provides a detailed record of the student's clinical performance and progression throughout the course. It is the responsibility of the clinical course faculty to ensure that evaluations are completed in a timely manner and that the students are provided with a constructive feedback based on their performance. Faculty must also ensure that students are aware of the implications of their evaluation ratings and necessary steps to improve if needed. Preceptor feedback forms must be completed twice per semester, once at midterm and once at the end of the semester by each student's assigned clinical preceptor or preceptors. These forms are a critical component of the clinical process, offering detailed insights into the student's performance, clinical skills, and overall progress in clinical rotations. All preceptor feedback forms are to be completed and stored in our third-party repository system. This platform serves as a central repository for all clinical evaluations and feedback. It is the student's responsibility to ensure that their assigned preceptor or preceptors complete the preceptor feedback forms by the due date specified on the course calendar. Students must proactively communicate with their preceptor to guarantee timely submission of these forms. The specific due dates for the preceptor feedback forms will be clearly outlined on the course calendar. Students are expected to adhere strictly to these deadlines to avoid grade deductions. Failure to ensure the timely completion of the preceptor feedback form may result in a delayed or incomplete evaluation, which could negatively affect the student's grade or progression in the program. It is imperative that students manage this aspect of their clinical responsibilities effectively. Course faculty are available to provide guidance and support to both students and preceptors regarding the completion of these forms. Any issues or concerns should be communicated to faculty as soon as possible to ensure all forms are completed as required. Students are also required to complete the student feedback form twice per semester, once at midterm and once at the end of the semester. These forms are vital for self-assessment and reflection on clinical experiences, helping to guide ongoing development and learning. The student feedback forms are housed within the Typhon system. This platform serves as a central repository for student assessments and feedback on their clinical rotations. It is the student's responsibility to ensure that they complete the student feedback form by the due date specified on the course calendar. Timely completion of these forms is essential for accurate tracking of progress and for faculty to provide appropriate feedback. Failure to complete the student feedback form by the specified dates may result in a delay in receiving feedback from the faculty, which could impact the student's clinical evaluation and progression in the program. Students must take responsibility for completing these forms on time. Faculty are available to provide guidance on how to complete the student feedback form effectively. Any questions or issues should be addressed to the course faculty as soon as they arise to ensure all forms are completed as required. In each semester, the APR and specialty courses, there will be a minimum of 5 touch points between the clinical preceptor and the clinical course faculty. These touch points are critical for maintaining ongoing communication and ensuring the student's clinical experience is well supported. 2 of the required touch points will be the completion of the preceptor feedback form as outlined in the preceptor feedback form policy. These forms are completed twice per semester, providing structured feedback on the student's performance. The remaining 3 touch points will be initiated by the clinical course faculty at the beginning of the course, near the midterm, and at the end of the course. Each touch point, including the completion of the preceptor feedback forms and faculty-initiated communications, will be clearly documented by the course faculty in the Typhon system. This documentation ensures the comprehensive record of all communications and interactions related to the student's clinical experience. While a minimum of 5 touch points are required in each specialty course, clinical course faculty reserve the right to initiate additional discussions with the clinical preceptors at any point in the semester. These additional communications may occur for any reason, including but not limited to addressing specific concerns, providing further guidance, or discussing the student's progress in more detail. It is the responsibility of the clinical course faculty to ensure that all required touch points are completed and documented. Faculty are also encouraged to maintain open lines of communication with preceptors beyond the required touch points to support the success of the clinical experience. And here is a slide with your contacts for anything clinical. Again, our administrative assistant can be reached at the USI-1 nursing at usi.edu email. Their phone numbers here as well. Again, this is where you will submit your preceptor agreements, your education affiliations, and your site surveys. Ms. Tammy Hall is our administrative assistant. She houses our questions or fields our questions for Castle Branch and course override. So if you're having trouble registering for a course, she's your contact. And again, here's my information provided at the bottom.